Patient I'll be presenting this week is a 16-year-old male, history of MDD and GAD. In regard to his medications, this is for a med follow-up, by the way. In regard to his medications, he's currently not taking his prescribed Prozac and hasn't been for about the last 3 months. Since stopping the Prozac, he has experienced increased irritability, increased anger. Oftentimes it's related to not getting what he wants, and he, those are his words, not mine. In regard to suicidal thoughts, he reports having some fleeting thoughts of not wanting to be here. There's no plan or intent to harm himself, but the thoughts are there. They're easily redirectable. When asked directly if he was currently suicidal, he said no. He has no history of self-harm and denies current self-harm, denies psychosis. In regard to school, he says overall it's pretty good, but he especially since discontinuing his Prozac, he gets easily agitated, and that sometimes interferes with his work. He recognizes that the Prozac was helping a little bit, and that he should probably get back on that, and maybe play with the dose a little bit once we get him back to where he was. In regard to his appetite, he's eating well. In regard to his sleep, he's sleeping well, getting somewhere between 7 and 9 hours of sleep per night. He is active in therapy every other week, but he doesn't feel that it's very helpful, and states he would not go unless his mom kind of forced him. He's often resistant during those appointments and, quote, won't tell the therapist everything. As far as our plan for him, we're going to recommend continuing therapy, but start looking for another provider that he may be more comfortable speaking with. He says the lady that he's assigned to now he's just not comfortable talking to her, and would prefer a male provider for that. So they're going to start looking, between him and his mom, they're going to start looking for a male provider for his therapy. We're going to restart the Prozac at 10 milligrams daily for 1 week, and then titrate up to 20 milligrams after that week, which was his previous dose. We're also going to initiate guanfacine 0.5 at bedtime, and maybe see if we can get rid of some of that irritability. Follow-up is planned for 1 month, and yeah, thank you.